Good. Okay, how we doing?
Whew, that was much needed. Oh, man.
How we doing?
Oh, amazing.
Perfect. Yeah, that was a good one.
That was a good one.
Is that okay?
Yeah.
Yeah, with that thumb.
That was much needed right there. Oh my God, wow.
Feeling better, huh?
Yeah.
You're actually getting down,
I
right?
could actually get down on the floor. That's crazy.
So I was looking at your chart. I saw you're having some neck pain.
Correct.
So tell me a little bit about what's going on. And
So I'm trying to get the name of the actual thing, but it's like something degenerative, like
yeah, degenerative disc disease, or
yeah, something like that. So I basically I grind my teeth at night. But yeah, I have this neck thing. My neck is basically all over the place. So
Yeah.
I'm just basically that's basically the main issue.
Okay.
I have issues with like tingling and stuff like that.
Yeah.
But that's basically my main issue.
Okay.
Everything else is okay. I have some soreness in my wrist that I'm trying to see maybe checked out, see what's going on there.
Okay. That left wrist?
Yeah.
Okay.
I think that's it.
Yeah. Just feels kind of like dull, achy, and tight, or
Yeah, and also I don't know. Like I feel like maybe it's the left one. I mean, right one. It's feel like I don't know. I feel like it just feels weird right here.
okay.
So I don't know maybe what it is, but yeah, I'm trying to get that.
Not hurting you like a lot. It's more just kind
No,
of
it's more just
bothersome.
like something like an ache whenever I do certain things. Like maybe like this like that, and like I can feel a little pain.
Okay.
Sharpness over here.
Did you have anything that happened? Like you're working out in the
Not
gym?
not that I'm aware. It just came out of nowhere. I do work out.
Yeah.
Maybe like 2 or 3 times consistently a week. But yeah.
Okay. And then with the neck, you've got the degeneration that you saw on the X-ray.
Correct.
Was that the other chiropractor that took that for you? Okay,
yeah.
gotcha.
I went to the one that's always on Instagram. What's his name? The one
Dr. G?
Yeah, Dr. G. There you go.
He's the other big popular one here in Dallas.
Exactly. Yeah. So I went there, and they told me that the reason why I switched over to you is because you're much more closer to my place. Than,
Yeah, a little more
than
convenient.
He is, so it's more convenient.
Yeah, awesome. Now with the neck, when you originally went in, was there any type of like injury, like a car accident or anything like that, or?
No, I think it's just from wear and tear of just doing crazy stuff. You know, I party a lot. You know, so maybe that's it.
Yeah. Okay. So we'll take a look. We'll see what's going on. Typically, the good news is that when you do have degeneration, especially at your age, it's usually not very severe. So what we can do is just go in, we'll assess how well those joints are moving, and we'll see what's going on and kind of go from there.
Yeah.
Now, when you were talking about the kind of like numbness or tingling, do you feel that in the neck, or do you feel that going down your arms and
I
into
feel
your
that in
hands?
the neck.
Okay.
Yeah.
Does it ever go down into like your shoulder blades or into the arm?
Not really, but I mean, I do feel it kind of sort of down my shoulder, down my trap. But like, aside from that, like no,
not all the way down.
It's mainly like really like the bottom of my neck. Like I don't know if like with letter D, something like that, like C, something like that.
Oh yeah, like C7.
Yeah, exactly.
Okay. Well, it doesn't sound like we have anything too crazy going on. I know you rated your pain as about a 4 out of 10. Is that kind of accurate for today?
Yeah.
Okay. So let's just start by seeing how well you're moving.
Okay.
And then we'll go from there. And did you only want me to look at like your neck and wrists? Or
No, I wanted to do full body, man.
Full body?
You know,
okay.
You know, do what you gotta do.
All right, so let's do this. Let's have you sit up tall for me.
Okay.
Bring your chin down to your chest as far as you can. Okay, can you touch your chin to your chest? Okay, close. And then let's have you look up to the ceiling as far as you can. Okay, come back to the center. Look over your right shoulder as far as you can, and then your left. Okay, so we're moving pretty well there. Maybe a little bit limited coming over to the left.
Okay.
And we're a little bit tight going down, but nothing too crazy. And then let's have you stand right here for me. You're gonna face towards the door.
Okay.
Reach down, touch your toes as far as you can. Okay, not bad. Then come on up, bend backwards as far as you can. Okay, perfect. So not too bad. Was that painful there or just tight?
No, just tight.
Okay. All right, so let's have you have a seat right here for me and face this way.
Okay.
I'm gonna do, yeah.
Okay.
And go ahead and have a seat for me. Perfect. So we're gonna do a couple motions here, and what I just want you to tell me is if you get any of that tingling or you get any of that pain that comes out into the shoulder.
Okay.
So if I press down on the top of your head, any pain or anything get worse?
Yeah, a little pain.
Where do you feel it?
Like the bottom right here.
Okay, base of the neck. If I lift up, tell me if it feels better.
Yeah, it does.
Yeah, so that relieves it a little bit.
Mm-hmm.
What if we go here? Anything feel worse? Any pain?
No, it's a little tightness, I guess.
Okay, and then what about if we go there?
No, no pain at all.
Okay, and I'm going to turn you to the left.
Oh, that hurt right there.
Right here.
Yeah.
Okay, and then to the right. Feeling a little bit more stuck on this side. I don't know if you feel that. Okay.
Yeah, a little bit, yeah.
Right there. A lot of tension there. Okay. So we definitely got some stuff going on here at the base of the neck, upper back. So we'll check that out.
Okay.
Let's have you go face down for me. Your face will go right here where the paper is. There's a little handle here for you to grab onto.
Okay.
Awesome. All right. Not too bad here. We're a little bit tight right here, more so on the left side. Do you feel that?
Mm-hmm.
Yeah. Okay. A little bit on the right side down here. Okay. Now let's have you lay on your back for me now. And scoot up towards me just a little bit. Perfect. Yeah, we got some stuff going on right there too. Okay. And let's take a look at your wrist. So kind of both wrists, huh?
Yeah, I don't know. Maybe from working out, stuff like that. Who knows? But definitely feel it.
A little bit tight here. Okay, we're gonna come in here. Good.
Ooh.
Is that okay?
Yeah.
Yeah, with that thumb.
That was much needed right there.
Well, nothing too crazy on this wrist. Just a little bit kind of jammed up there. Let's take a look at the other one. Also feels like kind of right there as well. Good. Okay. So that wasn't too bad. Both those wrists feel like just a little bit jammed up. Sometimes that can just come through like pressing movements and things in the gym, stuff like that.
Gotcha.
So now let's kind of work through some of these other areas. We'll start with one up here high on the right side of your neck. Yeah, right here first. Good. Okay, how we doing?
Whew, that was much needed. Oh, man.
All right. Right here. Good. Now we're going to come in a little bit lower on this right side. Right in here. Oof, a little bit tight there. We'll try that another way and see what we can do. So let's do this. Let's scoot you down a little bit.
Okay.
A little more. Right there. Okay. So we're going to cross these arms here. Roll you. We're coming right up here. Deep breath in. Out. Good. Loose shoulders. Perfect. And here's that trouble spot in the mid back. So deep breath in. Out. Good. All the way out. Perfect. How are we doing?
Oh, amazing.
Okay. Now let's clean up that low back, and then we'll revisit that lower neck. So let's have you lay on your side. You're going to face me over here. So on this side, this is going to be more for your low back.
Okay.
So we're going to go right here. Deep breath in. Out. Good. Other side. And this side's going to be for that hip. This right side of where your tailbone meets your hip bone is very tight. So let's go right here. Actually, let's go this arm overhead. Perfect. Okay. Breathe in. Good. Perfect. Yeah, that was a good one.
That was a good one.
Okay, we're gonna do a little decompression with you. Try and open up that base of the neck. So this one looks scarier on TV. All right, lift that head up for me. And set it down. So no pain if I go here, right?
No.
Okay.
Actually, relief.
Good. So we're gonna take it kind of easy on you, but we'll get in here and open this up. So tuck your chin just slightly. Perfect. And now relax the whole head. Okay. Breathe in. Out. Helps to open everything up. Let's have you go face down. I just want to see how that is feeling at the base of the neck there. Still a little stick here. Let's see. Let's try one more thing here. So, turn your face to the left and lay your head flat. Or your right. There. Let your shoulders be nice and relaxed. I'll give you a little push here. Okay, back to the center. So, not terrible, but this spot here is still just kind of stuck for us. I'll try one more thing, all right?
Mm-hmm.
Nice and easy. A little bit. Okay. So that's something that we're probably gonna have to come back to when you come back in. But
like when you press on there, it's like I can feel the pain.
yeah, you can feel it kind of like shooting through. We got to decompress a little bit with the towel pull. But we'll kind of pay attention to that again when you come back. Okay, so let's have you hop up. We'll take a look at some of those movements again and see how things are looking compared. So I'll have you stand right here for me and face that way, and you'll reach down and touch your toes.
Oh my God! Wow.
Feel better, huh?
Yeah.
Actually getting down.
I could actually get down all the way to the floor. That's crazy.
Let's have you bend backwards as far as you can. Good. Okay, then have a seat. And let's look at some of those. Oh, sorry, in the great chair. Yeah. Let's look at some of those that were tight before. So you'll sit up tall, and your chin down to your chest as far as you can. Oh yeah, way better. Let's have you look up to the ceiling. Good. Look over your right and over your left. Good. Yeah. How's that feel compared to before?
Awesome, bro.
Good. Yeah. So you happy with your first visit here?
Yes, very much so. Appreciate it, man.
Absolutely.
I saw your videos too, so you know,
Yeah.
I saw them. I was like, yep. This guy's close. Definitely going to him.
Well, I'm happy to have you.
Thanks,
Happy
bro.
to help.
Appreciate it.
You don't have anything too crazy going on. You're a young, healthy guy. You may have a little bit of degeneration in the neck, but from what I felt.
Yeah, I actually also have that thing where basically they gave me to like restore the curvature of my neck.
Oh yeah, one of those kind of traction devices.
Yeah, exactly. Yeah. So like I just basically like lay down for like on this thing for like 15, 20 minutes.
Yeah.
And yeah, that's basically. But I haven't been consistent with it. But I've been trying to get back into the gym because I've been traveling, doing a bunch of crazy shit these past couple of months. So
yeah, all over the place.
Yeah, exactly. So exactly. But trying to get back into it. Ain't going anywhere this next month. So
yeah.
Yeah.
So I mean, you're a young, healthy guy. What I would probably recommend for you to start with is maybe like twice a month, so every other week.
Okay.
And then at some point we may taper you down to something like just once a month, depending on how you respond. Because I think for right now, especially since we want to get you back in not too long and hit that area again, so that we can get that base of your neck, like C7, T1, to open up.
Okay.
We'll see you in about a week and a half, 2 weeks.
Okay.
And then from there, we'll kind of evaluate how you're doing and just kind of keep.
Sure. Can we schedule that now?
Yeah, absolutely.
Okay.
And there's your card.
So
and then let's get you
so I'm actually friends with the doctor that sees me over there at Dr. G's office, and he told me, he said degeneration is disc disease. Practically, you got a straight neck and some disc height loss.
Yeah.
That's what he said.
Those are all relatively normal changes as we start to get older on x-ray, so I'm not super worried about that. The biggest thing for me would have been when we felt your neck, if we really felt a lot of difficulty getting those joints to move, everything felt very locked up, but you moved relatively easily. We are going to have to go back in there and hit that C7-T1 again.
Okay.
But based on what I'm feeling, the degeneration that you have is likely mild. The loss of disc height and things like that, like the straightness of the neck, has to do usually with muscle spasm.
Yeah.
So as we continue to work on you, the muscle spasm reduces, you start to get some relief, that curve will kind of naturally start to come back. Anytime that we get real tight, our muscles kind of straighten our neck out, and then on x-ray you'll see a really straight neck. But then usually what we see is over time, as that muscle spasm goes away, that curvature just goes back to normal. So it's not so much like you're bent out of shape, so much as your body is like holding you in this position. And so as we start to get things to loosen up and as we start to get you getting some more relief, that'll kind of sort itself out. So based on what I felt today, I'm not super worried about like the degeneration or anything like that. I think you're gonna do just fine.
Awesome.